Cats usually express their emotions through body language, sounds, and changes in their daily habits. That is why, when interpreting a behavior, it is important to consider its timing, frequency, and any accompanying signs together. If your cat slowly blinks at you, this is generally a sign of comfort and positive communication. Many cats can respond in a similar way to humans who slowly blink at them. But it is more accurate to read this signal together with the cat's overall posture, not on its own. Constant hiding may not be just a personality trait. Especially if a cat that is normally social suddenly disappears from sight, stress, illness, or pain should be considered. Because cats tend to hide their discomfort, a change in behavior can sometimes be the earliest sign. Rubbing its head against you is often a sign of affection and scent marking. With this movement, your cat may be marking you as part of its safe social world. Purring is often associated with comfort. However, some cats may also purr when they are stressed or in pain. For this reason, purring should be evaluated together with the cat's overall body language. A cat purring loosely on your lap may not be expressing the same thing as a cat lying motionless under the bed while purring. Kneading is generally associated with relaxation and a sense of security. But persistent kneading in an uneasy environment can sometimes also be a self-soothing behavior. If your cat is playing less than before, this should not be dismissed as simple moodiness. A sudden decrease in play is especially seen in cats experiencing pain. A sudden increase in meowing does not only mean your cat wants attention. Hunger, stress, fear, or pain can also increase vocalization. Especially if the tone of the voice has changed, or if your cat has started vocalizing very differently than usual, a veterinary evaluation is important. Urinating outside the litter box is often not stubbornness. Urinary pain, digestive problems, diabetes, kidney disease, and thyroid problems can all lead to this behavior. Sometimes the problem is not medical, but related to the litter box's location, size, litter type, or cleanliness. That is why, with litter box problems, the goal should not be punishment, but finding the cause. Expert sources recommend cleaning the litter box at least once a day. For senior cats, litter boxes with a low entrance and easy access may be more suitable. Scratching is not mischief, but a natural need. By scratching, cats both remove the outer sheath of their claws and leave scent marks. This behavior is also related to territory use, by leaving a visible mark. For this reason, providing appropriate scratching surfaces is a more effective solution. Excessive licking is different from normal grooming. Cats may spend a large part of the day cleaning themselves. But if there is hair loss, skin injury, or obsessive licking of one specific area, the problem should be investigated. Itching, parasites, pain, and stress can all trigger excessive grooming. Changes in eating habits are also an important message. Loss of appetite in cats can sometimes be an early sign of serious illness. Especially when loss of appetite is combined with hiding and lethargy, it should be evaluated quickly. Drinking more water and urinating more frequently may also be more than just a habit change. These changes can be associated with kidney disease, diabetes, or thyroid disorders. Suddenly becoming intolerant of touch may be a sign of pain rather than bad temper. Biting, pulling away, or retreating while being petted may indicate overstimulation or sensitivity. Holding the back hunched, moving less, and avoiding jumping can also be signs of pain. Especially in older cats, joint pain is often first noticed through behavior changes. Hissing, growling, and squatting usually mean a desire to increase distance. In such moments, the cat is often experiencing fear, overwhelm, or a need to defend itself. In this situation, giving the cat space is safer than forcing interaction. Difficulty adjusting to new people and new situations may be linked to early socialization experiences. Cats are sensitive animals when it comes to environmental change. Moving to a new home, a new pet, a new person, or changes in the household routine can all affect behavior. That is why, when interpreting behavior, it is very important to look at what has changed in the home recently. One of the most reliable rules is this: behavioral changes that start suddenly or become more frequent should be taken seriously. Because cats often communicate illness not through words, but through changes in their habits. The right approach is to observe without punishment and seek early veterinary support when needed. The key to truly understanding your cat is to look not at a single action, but at the whole picture.